Hi, my name's Kylie Field. I'm a lactation consultant in Halifax. I started off working in South Africa as a registered nurse and midwife, and since coming to Canada I got into working with mums and babies as a postpartum doula, and then did a lot of breastfeeding support, and so that was a natural progression into taking my IBCLC exam. And I mostly work with families in private practice in my home. Parents usually look for breastfeeding support from a lactation consultant when they have painful breastfeeding, if their babies aren't gaining well, if the baby's fussy a lot of the time, if they are feeding with difficulty, they're either coming on and off or just not seeming satisfied at the breast. They also would look for help if they're having plugged ducts or mastitis, and that's an ongoing concern. Or if they perceive that they have low milk supply. Another reason would also be if they are returning to work or looking to wean the baby, and sometimes they need help with direction in that, as well as bottle feeding a breastfed baby. We do tend to work with families who want to do that as well. It's not, it doesn't have to be one or the other, so we do help with bottle feeding as well. Top tips for breastfeeding would be prepared prenatally. Read books, look at videos, go to breastfeeding support groups and talk to other people who are breastfeeding. Try and get this information prenatally. The second one would be, if it's painful, get help and know who to turn to early on in those early days. A little bit of help can go a very long way. The third one would be, trust your parenting instincts. You'll never be wrong, so just right from the beginning, have confidence in that. Learn how to hand express. That's something that you can learn how to do in the few weeks before you give birth, and it's a very valuable skill to know how to hand express and to know how your breasts feel postpartum as well. So some of these tips might change depending on the age of the baby. A 4-month-old baby might feed for 7 to 10 minutes and be done and happy to play and be satisfied for the next 2 to 3 hours, whereas a newborn might need to feed every couple of hours, and their feeds typically last a fair bit longer and might probably feed between 20 to 40 minutes. So we want to look at different ages of the baby, and their needs and their cues are slightly different as they get older as well.